That's what you need to ask your doctor to make absolute certain that you have the right surgery scheduled. If they say ablation, I know this sucks. Like this, depending on the situation you're in, how long you've had to wait for surgery to even get into seen in the first to be seen in the first place. Like this is not what you want to hear, I'm sure, but you need to cancel it. What's up, ladies? Welcome to the health class she deserves. Today I have a no makeup, down to earth little episode for you guys. I recently posted a TikTok that got a lot of traction talking about some not so fun facts about endometriosis. And the comment section was full of both heartbreaking stories, hopeful stories, and a lot of questions. And so I wanted to answer some of the questions that came up about endometriosis in just kind of one more long form, easy to find content medium space here in class. So welcome. This is going to be pretty brief. Just kind of gathered some of the main questions that came up, and I'm just going to go through and answer them to the best of my ability. I do want to throw it out there. Obviously, the disclaimer in the show description, and it is a disclaimer I will give you now. I'm not a doctor. I'm not your doctor. I'm not a medical professional. I am not in any way giving you specific medical advice. I am speaking from my experience. I am speaking from everything I've learned from the professionals that I have talked to, and also from the other women that I have talked to in this space who have dealt with some truly horrific things. The only quote unquote like quasi medical advice that I will give right here up front is that the only person, the only doctor that you should be listening to, heart and soul, their medical advice is an endometriosis excision specialist. You need to find one of those. Your regular OBGYN, your regular general physician, any other specialist, it's not the same. And I'm not saying they're inherently evil or they're out to get you or give you bad medical advice, but it doesn't stop it from happening. I've heard true horror stories. I have heard straight up lies that women have been told, straight up, completely unscientific information that they've been given from doctors who were not endometriosis excision specialists. And so any advice that you get from any other doctor, take with a grain of salt, especially if it's not sitting right with you. Go home, do your own research. An endometriosis excision specialist is the only doctor that you can truly trust to validate your experience. That is, and I'll get into that one in one of the questions actually, but a lot of times by the time you get to an excision specialist, they're validating your experience and they're asking what you want to do. They're the only ones qualified to do the surgery. They're the only ones qualified to give actual treatment and medical advice on endometriosis. And so that is what I will preface with as I start going through these questions. So the first one, this is a big one. It comes up all the time. Should I get a hysterectomy for my endometriosis? And it's a very nuanced answer, obviously. Honestly, the answer is it depends on who you are. Of course, it depends on your family plans. But here's the thing. There's a lot of doctors out there who are like, oh, just get a hysterectomy. It will cure it. Because so many women's most debilitating symptoms have to do with their, pelvis and their pelvic area, their pelvic organs, including the uterus, especially on their period. It's a really big symptom that is super debilitating for a lot of women. And so they say, oh, just get rid of it. Super nonchalant, offhand. Sure, just remove an organ for funsies because you just want to get me out of your office. Okay. That tends to be the general attitude around it. And a lot of times women are told explicitly or just simply led to believe that their problems will disappear once they get a hysterectomy. But here's the thing. Endometriosis can be found, has been found on every major organ in the body. It can grow anywhere. It can grow in the brain. It can grow in the heart. And obviously those are rarer cases, but they exist. They're not as rare as you might believe. Typically, endo is contained in the pelvis, but again, not always. And it is not always on the uterus. I do not have endometriosis on my uterus. And you can listen to my endometriosis story in some of my other episodes if you want the full gist of that. But I don't have endo on my uterus. That doesn't mean that my uterus doesn't give me a whole lot of fucking pain. Okay? Because there are definitely times where I'm like, yeah, this fucking hurts so bad. I never want to feel this again. Get rid of it. But no, that's crazy. I have hope that this excision is just on the whole. I mean, generally, since the excision, my pain has on the whole been less, despite still having some really bad days here and there. I do think that it's been less often, but I'm still not even at that 6-month mark yet. So we're getting there. And of course, I'll keep you guys posted. But the point is, removing my uterus doesn't mean that my endo is going to go away. That's not how it works. So hysterectomy does not cure endometriosis. We do not have a cure for endometriosis. Does that mean that you shouldn't get one? That is up to you. Personally, I would like to keep all of my organs inside my body as long as I possibly can. However, if it got to the point, some people, have to get certain organs removed because they're so deeply infiltrated with endometriosis. It's like it would be easier to just take this out. Other people bleed so heavy and for so long that they're anemic or it becomes dangerous. That's another reason why, removing the uterus, not going to cure your endo, but it can definitely help with alleviate some symptoms depending on how often your symptoms are, how severe they are, if they're life threatening in terms of like the bleeding and that kind of thing. So it's a very nuanced thing that you need to be having a conversation, not just with any doctor, but with what is it? An endo excision specialist. And you and that doctor can work together to come up with a plan. If a hysterectomy is something you're considering because you are done having kids or you don't want to have kids, then that is a conversation that you can have based on your like unique situation. It is just extremely important to understand that it will not cure endometriosis. And say you have bowel endo and you have like pain while going to the bathroom, that's not going to stop because you removed your uterus. But if your like main symptom is really heavy periods, really painful periods, and you just don't want the periods, then yeah, hysterectomy could be an option. But also, hormonal interventions can stop your periods. Like it's all very nuanced. It's all very personal. I personally don't think that you should like jump immediately to organ removal if it's not necessary. But again, talk to your excision specialist. Okay. Does anyone else experience stabbing vaginal pain with arousal? Not with like sex itself necessarily, but just with arousal. So I did a little bit of like looking into this because there's a lot of pain with intimacy that is associated with endo. So this absolutely can be linked to endo without a doubt. Obviously, we hear like pain with penetration because the pelvic floor muscles are so tight, or then maybe there's endo like in the cervix or in that area that's also causing more pain. There could just be general inflammation, swelling, causing that pain. I personally have experienced dysorgasmia before, which basically isn't necessarily like pain during sex or arousal, but after you orgasm, you start like cramping uncontrollably. Like a few minutes after your orgasm, it's like these like crazy uncontrollable cramps for a few minutes. For me, at least personally, they are like less than 5 minutes, but like they take me to the floor sometimes. Like I literally can't stand up and I'm like, holy shit. And then they pass really quickly. It doesn't happen every time. It's a lot more likely to happen around ovulation for me. So there's a lot of pain associated with intimacy. Pain with arousal specifically can definitely be depending on where the endo is, can be, because like of the blood rushing to the area and the anatomical changes that happened when you're aroused, things, I am so sorry for using this word, things become engorged and that can potentially stretch on or pull at scar tissue, possibly, depending on where it is. And just general inflammation in the area. Like I supposedly, I do not have endo on my bladder. However, I still have a lot of like bladder symptoms throughout the month because of the general inflammation in my pelvis. And so I would think that also could be linked to it. And then also from what I've heard, so I just got in for pelvic floor therapy next week, so I'll keep everybody updated. But From what I've heard for people who have done pelvic floor therapy after their excision surgeries or for endometriosis, they, first of all, swear by it. It's like, everyone's like, you need to get into pelvic floor therapy. And then other people specifically say that their pelvic floor therapist told them that a lot of the pain itself isn't even necessarily from endo and from the scar tissue. It's from the tightness in the pelvic floor muscles that are like creating even more pain and like inflammation, whatever. And when they do the pelvic floor therapy, that tends to help a lot. And so when I saw this particular question about a stabbing pain in the vagina with arousal, I was like, okay, like I feel like that potentially could also be like these spasmic, like super tight pelvic floor muscles. So yeah, unfortunately, we just don't have like super solid evidence and like a whole lot of data on endo and the different symptoms and stuff. So this is all based on just, like I said, things that I know, things I've experienced, other people's stories. This is not by any means like a comprehensive list of what that pain could be, nor is it like a definitive, like, oh, it's definitely this. These are just some ideas that make sense to me as to why someone might experience that. Okay, this came up quite a bit in terms of this surgery. So, was my ablation for nothing? So, if you're new here, perhaps you don't know, endometriosis excision surgery is the gold standard treatment. It is where they go in and they cut the disease out at the root. It is absolutely paramount that you have an excision specialist performing that surgery for so many reasons. One, you know that they're going to do an excision, not an ablation, which I'll get to that in a second. They have gone through extra training. They've got the extra like fellowship training for endometriosis. So they know how it can present. Like endometriosis can come in a variety of colors. It's not always a big chocolate cyst that's like super obvious. When I look at pictures from my surgery, from my endo, it is so impossible to see in little places. Like it's practically clear, a little bit yellowish in another place. And it just, I don't have a big chocolate cyst. So any other surgeon that went in there probably would have told me that I did not have endo. So thank God I had a specialist, right? And they cut it out. An ablation is burning it. So basically setting a fire on fire, right? How's that going to help? It doesn't. An ablation is still performed quite often for endometriosis, and it's medical malpractice. If you ask me, we know beyond a shadow of a doubt that it is not proper treatment. Anyone performing it, I don't think they're like inherently evil. I think they either are on an extreme ego trip or they are not up to date on the diseases that they're treating. And that's the most likely case. And that's disgusting to me. You can't perform surgeries that can't be your life's calling if you're not going to stay up to date, at least generally, on the diseases that you're treating, especially when it comes to such neglected areas and neglected patients, such as women. Anybody performing an ablation is not an endometriosis specialist. That's like they're mutually exclusive. The Venn diagram's two separate circles of people performing ablation and excision specialists or and endometriosis specialists, because endometriosis specialists are excision. They're performing excisions because they know they've gone through all that extra training. They know that's the proper treatment for endo. So was my ablation for nothing? Potentially not. Like, look, if you are preparing for surgery, like no surgery is better than bad surgery. If you have already gotten a bad surgery, whether it was an ablation or just not with a proper doctor, it's first of all, you need to know it's not your fault. You got to release any sort of like shame you have associated with that because it is not your fault. I think a lot of people get into this kind of like shame spiral of like, oh shit, like when they find out afterwards that an ablation is not a proper treatment, they're like, oh my God, how did I let somebody perform surgery on me and like didn't even do my due diligence, blah, blah, blah. And look, I preach always do your due diligence, do the extra legwork and the extra research, not because we should have to, but because there are doctors out there doing shit like this. And so if you were a victim of a bad doctor who treated your endo without proper qualifications, quote unquote treated, it's not your fault. You shouldn't have to be doing all of this crazy extra legwork and all of this crazy extra research. You should be able to trust your doctor. Like they've gone through a decade plus of medical training. We should be able to trust them. And it is such a sin that we can't all the time. And we really do have to do our due diligence. And so it is not your fault if you got an ablation. If this is the first you're hearing the difference between ablation and excision and you're like, holy shit, I had no idea. What did I get? Definitely look into that. When it comes to the question, was my ablation for nothing? Like, chances are you got a diagnosis during that surgery, potentially. Maybe you already knew, maybe not, but either way, that provides like a mental clarity because of the gaslighting. I think that that in itself provides this mental clarity and this like healing of like, okay, I'm not crazy. Like, I really do have this really painful inflammatory disease. So I don't want to say it's like that an ablation was absolutely for nothing. But at the end of the day, the evidence does suggest that it causes more inflammation on an already deeply inflammatory disease. And it's just not proper treatment for endometriosis. So be careful with that. And if you have gotten, maybe I'll jump to this next question then. I'm not sure if I have the correct surgery scheduled. What do I do? Like 100% as soon as possible, you need to be asking the questions point blank. Like, just look your doctor in the eye, call the office, be like, are you an endometriosis excision specialist? Are you performing an excision or an ablation? If they say excision, then you say, are you an endometriosis specialist? Have you gone through the extra training to be an endo excision specialist? That's what you need to ask your doctor to make absolute certain that you have the right surgery scheduled. If they say ablation, I know this sucks. Like, this, depending on the situation you're in, how long you've had to wait for surgery to even get into seen in the first to be seen in the first place. Like, this is not what you want to hear, I'm sure, but you need to cancel it. One of my favorite people in the endometriosis space, Dr. Jolene Brighton, says all the time, no surgery is better than bad surgery. You are really risking more inflammation, more pain by getting an ablation. So if you're not sure you have the correct surgery scheduled, make absolutely sure I've given you the language in this episode that you need to have an informed conversation with your doctor. And then if it is not the correct surgery, if you're not satisfied with any of their answers, then you cancel and you find an excision surgery. You find an excision specialist. How do I find an excision specialist? How do I find a doctor who will listen? Like, these came up a lot on that video as well. First of all, by the time you get to an endometriosis specialist, they typically are the ones validating you. They typically, like, that is, I made a video about that too. And it seems like a lot of people had a very common experience as me, is like, there was no questioning, there was no gaslighting, there was nothing. She listened to my symptoms. She was like, that sounds very much like endometriosis. She did a physical exam and felt around a little bit and was like, what do you want to get out of this appointment? And I said, it's been 12 years. I want surgery. I want to know for sure. I want it removed. And she said, okay, we'll schedule surgery. And it was as easy as that. And that tends to be the case once you get to an actual specialist who's qualified to treat the disease. In order to find that, there is a Facebook group that I can link below. It is called Nancy's Nook. I personally didn't use it because my gynecologist did end up knowing a specialist that wasn't super far from me, only like an hour or so. And I was able to get in within a couple months. And so it kind of worked out nicely for me. But I know a lot of other people who have used this Facebook group and they love it. And there's so many resources in there about endometriosis and so many other endo warriors. It's, just a place for validation and names of doctors there recommended by other people who have had, correct surgeries. It's kind of just like a hub for all that information. So again, I can link that below, but that is always my number one like resource that I mention to people. If you haven't heard about it, Nancy's Nook on Facebook. You do apply to be in the group, and then once you're approved, you can find specialists listed on there. And then last one, kind of like in this vein that I'll do, should I cancel my upcoming ablation? That came up. And again, I'm not a doctor, but like I said, yes, I think you should. Okay. This came up in various forms. Is endo just something I have to deal with? Because as I said in the video, and as I say all the time, there's no cure. We don't have a cure. That doesn't mean we don't have treatment. So when it comes to like, is this just something I have to deal with my whole life? Kinda, but there are options out there. First of all, you guys know I've talked about hormonal birth control before and how it's a very personal decision. And I personally like really, really just I want to cycle for as long as I can. If my endo were to ever get like significantly like more severe and unbearable, I would consider it, but it is a like last resort for me. So I understand not everybody wants to be on hormones. However, if you do, then first of all, I definitely recommend the book by Dr. Sarah Hall. Oh God, I'll put it in the show notes. It's called This Is Your Brain on Birth Control. And she does like a phenomenal job at laying out all of the research, albeit limited, that we have so far on birth control and how hormones in general, like how they affect our brains and our lives and how they can affect like other parts of you and what to expect and what to notice and how to have conversations with your doctor. The book in no way, shape, or form is trying to talk anybody in or out of using hormones, which I love. Like it is very much, she keeps her opinion out of it. It's the data, the science, and it's super informative. So I always say that like before any woman starts using hormones, she needs to read that book because it's all the information that they don't give you that you should have. Because there is a really gross like lack of informed consent when it comes to prescribing hormones. So that book's an incredible resource. However, if you do decide to go that route, a lot of people do experience like relief with their endo symptoms. From what I know, like endo is very sensitive to estrogen and like creates its own estrogen. Like there's a lot of studies coming out about that kind of thing. So progestin only pills are typically what endo patients end up going on. I've heard that a lot of people with endo like the Mirena IUD, but like I've also heard other people just have had IUD horror stories with that as well. So I don't know. But either way, that is like a form of treatment that we have. I know it's annoying when like that's literally the only thing we ever give women for anything at all. But when it comes to endo, there is, relief there for a lot of people. That's the other thing with This Is Your Brain on Birth Control sheet. There's really useful charts in there about the different types of birth control and then also the different types of progestin. So there's 4 generations of progestin and um so like for example the first 2 tend to have more androgenic, is that the word, androgenic effects? Because progestin is synthetic progesterone, right? And it's derived from testosterone, which not everybody knows. And so while it does its job as progesterone, it also can potentially bind to testosterone receptors as well. And so there's certain generations of progestin that are better at not binding to testosterone. So women who experience those more like masculinizing effects on birth control, and that's why they don't like it and wanted to go off of it. Like, I don't know, like acne or like hair growth in unwanted places, like those types of things. It probably had to do with the generation of progestin that was in whatever pill they were taking. So then there's the 3rd and 4th generations, which are a little bit like better at not binding to testosterone. But then there's also like the low libido side effect. It's just super informative for that kind of thing. So if like you have had a bad experience with birth control before, but only tried like one, I would definitely recommend like figuring out what generation of progestin it was, if it was a combo pill or just progestin only, and like, go from there. And then, of course, like I've said multiple times already, the gold standard treatment is an excision by an endo excision specialist. And so that's another really amazing form of treatment that a lot of women experience an immediate relief after that surgery. And for me, I don't want to say it was like an immediate relief. Like I think when I've spoken to women about that in particular, they were like stage 3, stage 4, had it on multiple organs, like had organs kind of glued together. And so obviously when they got a surgery and had that removed and had those organs like detached from each other that had previously been glued together, they obviously woke up and like immediately felt lighter because, their bladder and their bowels and intestines and uterus and everything was like where it was supposed to be and where it hadn't been before. Um, And depending on how many lesions you have, and if you have an endometrioma, like those can be heavy. And so having that stuff removed can be an immediate relief. And for me, having stage 1, while it's like still super painful, I didn't have that immediate like lightness that other people reported because my endo wasn't causing like this heaviness on me that it has caused for other people. I still have noticed great improvements. Like I said in the beginning of the episode, like I still do have some like high pain days and flare-ups, but on the whole, it has been less, and I think it's improving, and I think it's only going to improve more as I get into pelvic floor therapy. So, yeah, on one hand, we don't have a cure. It can grow back even after you get it excised. A lot of us have to go through multiple surgeries in our lifetime. It's just kind of something that I'm, like, expecting to have to go through at some point, unfortunately. However, there are those things, like I said, and then just, like, lifestyle modifications. I know a lot of women have had success going on an autoimmune protocol diet. Just leading a general anti-inflammatory lifestyle helps a lot when it comes to symptom reduction and, managing the disease. You do have to be careful. I do see some people out there on the internet saying, like, "I cured my endo doing this," or, like, "I got rid of my endometrioma doing this," and it's like, I don't completely trust that because, like I said, we don't have a cure. Anti-inflammatory lifestyle choices 100% make a really big difference. Just common sense would tell me that it would help if you're supporting your body's natural healing pathways, like, common sense says that you would naturally be supporting, healing that scar tissue and, maybe preventing or slowing the growth of the disease, but we don't have data on that, unfortunately. The only like, the my advice is always track your symptoms, track your lifestyle choices, and figure out what is really, like, moving the needle, what's making a big difference, and what's not, until we get some actual solid data on women's health and on endometriosis. It's really just a trial and error kind of situation for us, unfortunately. So, no cure, but yes, treatment. There are definitely things you can do to manage the disease, and it is not completely hopeless. Okay. Kind of on that note, somebody was asking, like, should I use traditional Chinese medicine for my endometriosis? Meeting with a TCM doctor. And I have a couple of episodes speaking with TCM doctors. The one where we kind of got in the weeds, if you're more interested in like some actual terminology and like actual herbs, an interview from a few months ago, it was a little while ago with Dr. Chloe Weber. If you go back and find that one, if you're interested in the Chinese medicine side of things, that was a great episode. But ultimately, like, yes, I think Chinese herbs can be great. I use Elix on my Elix supplements where it's like a personal TCM formula. And I find that it helps a lot, not necessarily with the pain, unfortunately, but when it comes to bloating and mood stabilization and headaches, like it definitely was helping balance my hormones a lot. And so those symptoms that were a product of a hormone imbalance, they were resolved. Whereas the very endo specific symptoms for me, that was like my pain, those were, still present, unfortunately. But still, I love using herbs for cyclical health in general, whether or not you have endometriosis. That being said, you do have to be careful where they're coming from. A lot of herbs that come from China are like have heavy metal. They need to be third party tested for heavy metals. And the whole idea with Chinese medicine is that like it's not one size fits all. What works for you might not work for somebody else and vice versa. And if you have like a very, like fiery, I'm not going to use the correct terminology here, but if you have like the, fiery profile, whatever, like you might need cooling herbs. Whereas like if you are really cold and stagnant and have this like stagnant blood flow, which can also cause a lot of menstrual pain, then you would maybe need more fiery herbs like the ginger and turmeric, which I find great success with those. And so I'm not an expert on that, but I do love using herbal medicine and traditional Chinese medicine to help manage my endometriosis. But I will say anybody on the internet who's just kind of like an influencer and who's touting some one size fits all solutions or charging an arm and a leg. Like it just, you do have to be careful with who's selling it, where it's coming from, if they're actually qualified. Typically for like a personalized herbal formula, you need some sort of assessment or like a meeting with a practitioner before actually getting an herbal formula. You know what I mean? So it does tend to be a little bit expensive. It's not in everyone's price range. Elix is like, I want to say every 3 months I'm charged like around $100 because it's a 3-month subscription. So a few hundred a year. Not horrible, not the best either. Okay, moving on. This one came up in various ways and it makes me so mad. My doctor said to get pregnant. Why? Literally why? If your doctor tells you to get pregnant to help solve any problem, you should look at them like they have three heads and just make them feel as dumb as possible because what? There is no scientific data on pregnancy and endometriosis. A lot of women, have reduced endo symptoms while they're pregnant because, hey, they're not cycling. They have a fuck ton of progesterone. That makes sense. But 9, 10 months of relief and then an 18 plus year investment, hundreds of thousands of dollars while you continue to cycle through pain once you start ovulating again. Like what? It just doesn't make any sense. And I heard there's plenty of women who commented on that video who said that their endo pain got worse after they gave birth. And then others said the opposite, that their endo pain actually got better for a little bit. And then some people said that it was better and then got way worse. It's individual. And again, we don't have enough data on it. There's absolutely no reason that a doctor should be telling you to get pregnant. Not to mention, a few people did point out like the disgusting and insensitive irony of that because 50% of infertility cases are due to endometriosis. So you're dealing with a disease that causes such like rampant and painful infertility, which is like just such a sore spot for so many women. And then you're like, well, just try to get pregnant. And it's like, okay, first of all, a lot of them can't, even if they wanted to. And second of all, what the fuck is that going to do? What the fuck is that going to do? I don't think any doctor saying that should have a medical license because here's the thing, whether or not it's their intention, that idea of just prescribing pregnancy to women as a cure-all is a way to keep them in the home. It's rooted in like deep-rooted misogyny and it's pervaded throughout recorded history. And you can see it in, Victorian era medical practices and even with like Aristotle, like Greek philosopher days, like it was often touted as a cure for hysteria, the wandering womb, that whole thing. It was like, oh, get pregnant. And these were the same people saying to put garlic at the nose and honey at the vagina in order to get the womb back in its place because it was just wandering aimlessly throughout the body because it was so sad and forlorn that it didn't have a baby in it. So, like, yeah, they were truly crazy and incredibly biased, and none of that was rooted in science. I don't think anyone needs to be told that modern day. Um, Yet we still have doctors very often. I hear this very often where women are saying, my doctor told me to get pregnant as a cure for endo or as a way to treat endo. And it's just no evidence to that effect. We don't have a cure for endo. That's also just ridiculous. That is a ridiculous thing to say to a woman, and its roots are so sexist. And so whether or not it's their intention, it's stemming from an incredibly unchecked bias, not science, and it's okay to tell them that. Be respectful, obviously, at least at first, if they're being respectful to you. You don't want to be rude, but also if they're being rude or if their ego is getting in the way, then yeah, that's okay. You can be sassy about it. Because I think that's just an absolutely absurd thing to say to a patient. So yeah, that came up. There were also a couple about, so like somebody said they had severe rib cage pain around their period, and somebody else said that their lymph nodes were swelling before their period. And so this brings me back to endometriosis can grow anywhere and has been found on every major organ in the body. And it has also been found in the lymphatic system. And so while swollen lymph nodes before your period doesn't necessarily mean you have lymphatic endo, it can, and it's often, mistaken for other things first because your lymph nodes get swollen when you're fighting an infection. And like, so, it really could just be that. And a lot of women get what we call the period flu. Your immune system's a little bit weaker in your luteal phase. And so, especially at this time of year, if you're in a colder climate, lymph nodes getting really swollen before your period could potentially be your body fighting an infection, absolutely. But if this is happening like all the time, every month, it's very cyclical. It is absolutely something that needs to be looked into with an endo excision specialist. So I would start by tracking your symptoms meticulously. Everything, even the things that like a tiny little twinge in your right kneecap, like just track it and where at in your cycle and mental health symptoms as well. Like all of these things, you just want the most complete set of data on yourself for a few months. And then you can bring that to your doctor and you can say, hey, I've noticed this really cyclical pattern where my lymph nodes get real swollen before my period. Or the other ones, my rib cage gets severely is in a lot of pain right before my period, because you can have diaphragmatic lesions as well. Like you can have lesions in your upper abdomen. Like, it's not just in your pelvis necessarily. And so these are important to track. If they're cyclical, then like advocate for yourself, get in with a specialist, whatever you have to do. Because you only get one body, you know? You only get one body. Coming up on the end here, what if I don't want surgery? Because like I said, gold standard treatment, endo excision surgery with a specialist. That is the gold standard treatment. And unfortunately, it's the only way to definitively diagnose or rule out endometriosis. You can't say to anyone experiencing symptom or even not experiencing symptom, you literally can't say to anybody that they definitely don't have endo unless they have been operated on by an endo excision specialist. And this is as of October 2025, because it does not show up on scans like 99.999% of the time. If you have a huge giant endometrioma, chocolate cyst, something or other, yeah, that might show up on an MRI. If it's like deeply infiltrating, it might show up on an MRI. On an ultrasound, probably not. There are specialists who do special ultrasounds, but that's not what most of us are getting done. Also, like I said, endo comes in all different sizes and shapes and colors and all different places in your body. Like, just because you have an MRI, like mine didn't show up on an ultrasound or an MRI, and that is the normal experience. Most people do not see it on imaging. And for me, I really wanted that official diagnosis. It was like a mental healing moment for me. I wanted to definitively be able to say, yes, I have this disease. I obviously wanted it removed as well. But honestly, the main driver was like, I need to know for sure because all my testing is clean. There's no blood test for it. Imaging is normal, quote unquote normal. Like, I really want the surgery. And so that was my kind of reasoning behind it. For people who say they don't want surgery, again, I think that the only person that you really can be trusting to give you the most up-to-date and accurate information and advice on this is an endo excision specialist. And I think you need to have that conversation with them. You need to present your unique case to them. You need to track your symptoms really well and you know, show them all of it and be like, look, this is what I'm dealing with. Like, what do you think? Based on their expertise and what they've seen, like they can probably draw a conclusion as to how bad it might be. But here's the thing is like, we just don't know enough about it. And some people, such as myself, have stage 1 and have like extreme pain. And then other people might have stage 4 and they barely have any pain at all, if anything. And so it doesn't necessarily correlate. So just based on your symptoms, no one can really say how bad it is. And even if you have something show up on imaging, it doesn't mean everything showed up on imaging. Endo, it is rare for endo to be life-threatening, but it can be life-threatening. You can have bowel obstructions. It can be on your heart. Like I said, like there are just so many things. There's so many reasons why I think it is important if you like truly suspect endo or know you have it to get the proper surgery done, just because you never know where it's growing, exactly how bad it is. Like it's just don't have enough data at this point in time, and it sucks and it's not fair. But and again, I'm not a doctor. I'm not saying that you absolutely need to get a surgery. I'm just saying that like you just never know. And I think that you really need to dive into your unique case with a specialist and decide with them if you think that it needs surgery or if you can manage it without, or if you are going to go in every, however many months for imaging or whatever, just to make sure things don't become like super deeply infiltrating or whatever it is. And then, God, this isn't like the happiest note to end on, but will endo continue to grow throughout my life? And it kind of goes back to what I was saying earlier of like, yes, there's no cure. Just because you get an excision doesn't mean that it's just taken care of. It absolutely can grow back. But like I said, leaving an anti-inflammatory lifestyle, modifying your diet, like really tracking your symptoms super well and your lifestyle choices super well and figuring out what works for you and what doesn't can really, really be useful in helping to manage your disease, because it can continue to grow throughout your life. Will it? Absolutely. No, not necessarily, but it can. And unfortunately, we don't know enough about stopping that spread at this point in time. So that is all. Thank you guys for listening. If you have any other questions about endometriosis, please feel free to reach out. Autumn at thehealthclassshedeserves.com. You can email me there. I'm on social media. Also, you can DM me anytime. I love hearing from you guys. So please reach out. Let's chat. Let's keep the conversation going and continue spreading awareness and proper education about endometriosis. Class dismissed.